Doing it. How are you? It's September 29th, 2019. So let's get right to it here. Let's go ahead and get into our Blackboard course. Um, you guys are doing great on the CT. We've been really enjoying grading it. It's cool how you all figured out how to go in there and get your data and interpret your data, and that's what it's all about. That's your future. So very cool. All right, let's just get right to it here. I'm going to get into this week's lecture. And here we are, week 6. Is that amazing? Huh? If you think about it, how did we get here? All right, week 6. Okay, so everything's due on October 7th. Okay, I'm here's the Sunday night before the cancer module is done. Hopefully, you all had a chance to watch Julie. Very heartfelt message from her about cancer. Okay. So this video will be going right here, as always, okay? And so this week is about diabetes, okay? And this is a kind of a crisis of excess, okay? What it is, this is a disease that is linked to overnutrition and genetic susceptibility. And so this is a disease that we see in developed countries, okay? I'll never forget, I had a close friend work for me for 25 years. He came from Azerbaijan. There was political unrest. He was Armenian. And so at that time, they had a special program, so he got very rapid citizenship, and he was a doctor, and he worked for me in my lab for many years. And it blew his mind when he got here to walk into an Albertsons and see unlimited food. And that's the hard part for all of us is to fight, basically our ancestral needs. Our evolution tells us, God, I don't know when the next meal is going to come, so I'm going to eat everything I can, And so you go out to dinner, you go across the street to the lab, and you get these giant burger and fries, you go to the Cheesecake Factory and have, a single serving that could feed 4, and you eat the whole thing, and that's the hard part. Sorry. Again, it's genetic susceptibility. So if you have a family history of diabetes, then you're the one that really, really needs to be careful, okay, in terms of your diet and your exercise, okay? Reducing your stress. All these things contribute to diabetes, and we can't get into all of them, okay? Obesity is a big player. Your stomach, your tummy fat actually becomes, your fat is your largest hormonal system in your body, and it's also your largest, when you have a large tummy, your largest kind of global chronic inflammatory system. So obesity puts you at risk for cancer because of all the different types of hormones and what are called inflammatory messengers, okay, these cytokines. And at the same time, it puts you at risk for diabetes. When you have a big, giant tummy, all the chemicals and even the fats that leak out of the fat tissues and fat cells, they go in and they cause your muscle cells and your brain cells and your kidney cells to become resistant to the effect of insulin. And so the nutrition doesn't get packaged correctly, and then everything gets, all that sugar in your blood gets candy coated, and then that begets more inflammation. It becomes this downward spiral. Okay, so that's kind of a real simplistic view of some of the basic biology of diabetes. Diabetes puts you at risk because it just totally hammers your vascular system. It's kind of like having old plumbing that gets caked with just deposits, and this is what happens in diabetes. And exercise will scrub those deposits, okay, removes the plaques, but the plaques develop, and especially in obesity. And if the plaque develops into the artery that goes to your heart, you get diabetic heart disease. If it develops in the artery that goes to your brain, you can have a stroke. We'll kind of go through that. If it develops in your artery going to your kidney, you get kidney disease, on and on and on. Those are the big players, the big arteries. Okay. Alrighty. When you look at the layout, we have put all these PDF files just in case you had issues here with the website. The website is spectacular, okay? That is the best way to go in there and find out information, okay? So what I encourage you to do, again, all this, you have to, you get out of life what you put into life, guys, So it's really important that you go in here and just kind of show some intellectual curiosity and go around and find out what is going on with all this. Because a lot of you have to deal with this, okay? You're at genetic risk. Your parents have diabetes, okay? Your grandparents have diabetes. To be an informed consumer so you can get the best medical care and interpret what's going on in terms of drugs that are being given and also lifestyle changes, it's time to man up or woman up and get educated, so that you have a fighting chance to get the best possible care and beat this horrible disease, all right? In combination, diabetes, heart disease, stroke, kidney disease, this is all called the metabolic syndrome. And it's, the statistics are kind of staggering. We have in our country roughly 35 million people with diabetes. That's such a financial burden, okay? It's such a burden on those people that suffer from the disease. But, if they don't have health insurance, then we're paying through our tax dollars, okay? Even if you do have health insurance, it doesn't cover everything, okay? So this is a big, big economic problem. This is remember we looked at the very beginning, the non-communicable chronic diseases of aging. This one's a biggie, okay? Because as you can see, it's like a wheel and the spokes coming off. So diabetes puts you at risk for cancer. It puts you at risk for heart disease. It puts you at risk for kidney disease. It puts you at risk for stroke. And we're going to learn later on that it puts you at risk for Alzheimer's. Okay, this is staggering statistic is when we look at Alzheimer's disease, 80%, 80, suffer from diabetes. All right, so this is why and it's the easiest and yet the most difficult treatment program. You just have to exercise and watch your diet. And that's it. You surround yourself with supportive people and reduce your levels of stress. All right, so I'm going to click on this just to show you this, okay? So I'm going to open it it's a PDF file with Adobe Acrobat, okay? And it kind of goes through the things that I was telling you about. So what's the link between all these? So again, in a nutshell, it's damage to your blood vessels, okay? And when it's the blood vessels, supplying the blood to your brain, then you're much likelier to have a stroke. When it's your heart, your heart begins to die off, or you can that's heart disease, because it's just not getting enough oxygen. The pipes are all clogged, And when it's your kidneys, you can lose your kidneys, and then then you're on dialysis the rest of your life, or have to get in line for a kidney transplant. So this managing your diabetes and avoiding it, is huge, okay? And there's we'll see there's a video. These are just some of the complications you get from really bad blood flow to your feet and legs. People get diabetic neuropathy, bad blood flow to your eyes. They go blind, okay? So it's diabetic retinopathy. So it's a big deal, okay? You can compound this with smoking. Smoking has chemicals that actually kind of like a little razor blade, it just kind of irritates the internal blood vessel, and then the immune system races in there to try and fix it. Anytime you have a wound, your immune system is trying to repair your wound, but it just doesn't do it right, and boom, that clogged plaque begins to form, okay? We all have the same blood volume, whether you have diabetes or not, whether you have the diabetic complication of atherosclerosis or not, and so same blood volume, smaller pipes, boom, blood pressure elevates. And what does that do? That injures the blood vessels more, okay? Causes more inflammation. You get then through this inflammatory process, you deposit the cholesterol. And that's why we got to lower our cholesterol levels. And then this, again, is such a huge risk factor because this is the center of the really horrible inflammatory response. Okay, inflammation underlies all chronic diseases of aging. It's just, the immune system, has, the best, your best interest in mind, but when it's chronically activated, it's a problem. And what happens with obesity is your fat cells get so big that they begin to explode, and the immune system will race down there and try and gobble up the exploded cell and try and repair it. It's no different. Remember when I had that gash in my arm leg? So it's all repaired because my immune system went in there and did tissue repair. So anytime you get a cut, your immune system's doing its job. It's like you have constant tearing up in here. So the immune system is flipping out, and all the messages that get released not only go here, but it goes everywhere in your body. Okay. Alrighty, family history, it's just how it all plays out, how you genetically respond to these kind of things. Some people, when I was a kid, I used to work out, and I stayed skinny, because genetically that was the way my muscles responded to the stress of, putting the load on it with weights and stuff like that. Other people genetically work out and they get just strong and massive. We all are who we are. Some people are going to be at super risk for getting diabetes because of those genetics, okay? So this tells you all about managing it. The A1C test is a measure of just the constant chronic level of glucose. It's candy coating hemoglobin, okay? It's a part of your blood vessels, and it's just a readout of how bad and chronic it is. Here's your cholesterol. Again, you should reduce it because the cholesterol, L stands for lousy, H stands for happy, all right? This happens with lack of exercise, overnutrition. This happens with exercise, okay? It's pretty simple right here. H stands for happy, all right? So this scrubs your blood vessels. It removes all the crap takes it back to the liver. This is produced by the liver and by overnutrition, and it gets all deposited in those scars in your blood vessels. Smoking creates the scars where it all radiates to, all right? So that's what all this is about, and I really encourage you guys to look this over, to show your parents, to talk about it with your grandparents and parents, all right? Super important. All right, so this right here is the website, all right? So again, you can see where I've been showing curiosity, and that's basically what I want you to do, all right? So you're gonna find out what is diabetes, all right? So you just click on that, and boom, it tells you exactly what's going on here. The different types of diabetes, okay? Type 2 is by far the most common. It is a chronic, age-related. It happens over 30, 40 years, okay? Type 1, okay, it's called type 1 juvenile diabetes. Type 2 is adult onset. Type 1 is a rarity. If we put together all the cases of diabetes, okay, it's a little bit less than 10% of the total diabetes is type 1, okay? It's less than 1% of our country, whereas when we look at our country in terms of total percentage, almost 10% of the population has type 2 diabetes, okay, the one that you can kind of control. Type 1 is an unfortunate problem where the immune system attacks your own body, and there is, it's a combination, again, of genetics and environmental exposure, all right? Type 1, you have to inject insulin. Type 2, there are other drugs that you manage to increase the sensitivity of your insulin receptors. But in the end, you may also rely on insulin, okay? So this goes through type 1 and type 2. Because of the hormonal situation changes, a lot of women develop gestational diabetes, and it's really, really harsh. It puts the mom and the baby at risk, so it has to be managed, okay? Because your hormones change a lot. Your estrogen goes just skyrocket, okay, when you're pregnant. Again, these are the complications: heart disease, stroke, kidney disease, like I was saying, okay, eye problems, dental disease, nerve damage, foot problems. When diabetes goes out of control, the immune system is so harsh on the foot, and you have such bad blood flow to the foot, it becomes necrotic, and people actually begin to lose toes, they lose their feet, they can even have loose legs. So yeah, you don't want to go that route. So that's what diabetes is all about. Your parents may get tested and this describes the hemoglobin A1C test. Okay, this describes some of the problems that I was talking about. So I just want you to kind of sift through here, go in here and look at, for example, gestational diabetes, okay, and show some curiosity, okay, how it's tested, how it's defined, things like that, okay. Alrighty. Okay, so that's what that's all about. All right. Then just go down here, and I've inserted 2 videos that are very informative. This one's a little bit more biological, and it describes to you the type 2 diabetes, the one that is 99.5% of all cases. Okay, and where the insulin receptor insensitivity comes from. It links it back to, again, tummy fat and that kind of stuff. So you can click on that, and it'll take you right in to this. All right, so this is only a 3-minute video, so watch it, and you can open this up during your quiz. This right here is John, okay? And you can either go full-blown here or here. And John
I was diagnosed with type 2 diabetes some years
turned
ago,
off my audio.
and I'm here to tell you my story and some things about type 2 diabetes you may not know. You've just seen the prevalence statistics for diabetes.
All right, so in this situation right here, John's going to talk about all of the complications, the heart disease, the stroke, the Alzheimer's, all that kind of stuff. All right. Become informed. Okay, so then we come in here, and this is your discussion. Alrighty, this is a little interactive. It's kind of fun. Okay, so you're going to calculate your body mass index. Okay, all right. So we can come right in here. All right, click on this. Okay, body mass index. Okay, it says what is your body mass index. So what you do is you click right here. All right, and let's see, where am I? I'm 6 feet and 0 inches. I used to be 6'1". Go figure, I shrank when I got older, okay? I'm about 173 pounds, all right? And it says that my BMI is 23.5, all right? So that's cool. That's the range I want to be in, okay? Now, some of you will be shocked and say, wait a minute, I'm in super good shape. It doesn't account for muscle and bone mass, okay? This is where we're talking about when you're way up here, okay? So 25 is the range that you're 25 or less is the range you're kind of looking for. You have to account for a large bone and large muscle mass. But that being said, if you're a football player, and you're just unbelievably fit, you're a big dude, you're 230 pounds, all muscle. That being said, it's that person, okay, that later on in life is still at risk for getting diabetes, okay, because of the size and the nutrition and growth hormones that have pushed it in that direction. When you eat a lot of food, you release a lot of insulin, a lot of IGF-1. Okay, I'm not going to get into this, but do understand that insurance companies will look at this and they assign you risk in terms of what your premium will be. Okay, if you're outside the normal range, then what happens is your health insurance costs more. Okay, so that's life. If you're trying to get a life insurance policy and you're in this range right here, no, they're not going to give it to you. Or if they do, they'll charge you a godly amount of money. All right, that's just the system. All righty, so you've done that. Okay, and then what we want you to do is go look at your life expectancy. Okay, alrighty. So this right here. Okay, you click on this, and there's a bunch of really cool calculators in here that is offered by the Social Security system. And I encourage you to show this to your parents. Your retirement estimator. We're going to get into this later on. How much Social Security you can get. Okay, early retirement calculator. All this kind of stuff. Life expectancy calculator. That's me. All right, so I'm going to select my option, male. I'm going to select my month. Okay, I'm a June baby. I'm June 30, and I am 19. Yes, crazy. Sounds like your grandparents. I am your grandparents. 1956. Boom. I hit submit, and right now, okay, the fact that I've lived to 63, okay, which is awesome, okay, means that I have an additional 20-year life expectancy, all right? If I live this far, okay, then you see my life expectancy goes up, okay? Because basically, if you're so kick-ass that you're living this long, then we've gotten rid of the people that have had heart attacks from diabetes. We're getting rid of the people that have had strokes or kidney disease from diabetes, okay? So you have a much, much, much longer life expectancy, okay? This is different. So this is from looking at me based on my the input that I put in, okay? The fact that I've lived this long, okay? We can look at something else, which is life see, at birth. Okay, and I'll put mine 1956. Okay, put that in there right now. Okay, boom, 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 boom. Okay, so you can see right here. Okay, when I was born in 1956. Okay, men and women. Okay, life expectancy was about approaching 70 years of age. Okay, so how do we get to this one right here? Okay, where I'm 80. Okay, because this includes people that died a lot younger from all the problems. Okay, I've blown past those problems, so yeah, I'm going to live longer. Okay, so that's how that is calculated. All right, so there you go. So I want you to do that. Then you get in here to a couple other things. Okay, so these are kind of fun because they're a little more interactive. Okay, so this one right here is by an investment company. Okay, so a lot of you guys are interested in this. Okay, so you come in here. Okay, and I'm a male. I'm white. Okay, so they have an algorithm. A programmer, and I had a friend who did eHarmony and programmed all that. Okay, 63. I am not 200. I'm about 170. Yeah, how about 173? I'm 6 feet tall. Okay. Life events, college graduate, greater life expectancy. Okay. Married, greater life expectancy. Currently working, greater life expectancy because I'm engaged. Yes, I make lots of freaking money. Not really. Okay. Fitness, I'm pretty fit. All right. General health, pretty good. Okay. Do I have diabetes? No. They got to put that calculation in. Okay. Do I drink? Yeah, I drink a little bit. All right. So I can put it there. Do I smoke? Never smoked cigarettes my whole life. There's my profile. Bum, 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 bum. All that. Okay. Okay. Here I am. That's my summary. Let's go ahead and calculate my life expectancy. Bum, 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 bum. All right, there it is, 95 years old. All right, a lot different than this one right here. Okay, because I had lots of variables that are predictors of long life. All right, I work out. I have moderate drinking. I've never smoked. I'm college educated. Okay, I make good income, so that bumps it to 95. Okay, so now they're trying to scare me because this is an investment company. All right, they're saying, "Are you prepared? Why not buy an annuity?" Annuity, we're going to learn later on, is a way to have guaranteed income. Don't do it. Okay, annuities cost you so much money, and you know what? If I tap into an annuity and throw all my money into it, guess who doesn't get it when I die? My kids. The investment company, insurance company, will take all my money. All right, so they're leveraging that in their calculation. Screw that. Okay, awesome. And then there's another one right here, same drill. Okay, where you get to put your information in. So here I am. I'm 63. I'm a male. I do not have any of those. I don't have heart disease or cancer. I exercise. Okay. Do I experience stress? No, I try not to. I'm pretty cool here because that's a variable. All right. It causes the same problems that diabetes does. Do I have a great social life? Absolutely. Hey, what do you mean no? Okay. Do I use tobacco? Never. Okay. Do I drink? Sometimes. Okay. All right. And Look at that, 89 years. Again, better than what they said here, but not as good as the other one. All right, so that's what that's all about. All right, I just want you guys had fun with that and discuss it, okay? All righty. So that is this week's lecture. I hope you guys enjoyed it. This class is awesome. It really is. You just have, you put in the effort and you're going to be amazed. You know, you can have, you know what you should do is over there in fraternity row, have a party, you know, where everybody starts doing this kind of stuff and see where you fit, man. You'll be the hit of fraternity row if you have a life expectancy party, okay? All right, Control Shift, stop.